Hello everyone, hello. Good morning, good morning. So yes dear, okay, so can you hear me, Shri and Naveen, Govindraj? Can you hear me? Let me know please. Can you hear me? Okay, so we will start with the session of ankle joint. Yes, we will start with the session of ankle joint. Myself Dr. Monalisa, and here we are going to cover up the important topic related, a very important topic, ankle joint, and also I will show you few other joints and which is very important and commonly asked as the type of joint, but we will study in detail about the ankle joint. Okay, so yes, let me. Okay, so can you see the screen? Can you see the screen? Let me know, can you see the screen dear? Okay, can you see the screen? So you can, yes, Amol, good morning dear. So yes, these are the sessions. Okay, yes, so you can see the screen also, very good. So let me start. Okay, so you can see the screen also. Okay, so let me tell you about myself. I firstly want to start the session. So myself Dr. Monalisa, I have done my MD Anatomy from Armed Force Medical College Pune, and this is my referral code ANAT10, which can be used by you if you want to be the part of free sessions and if you want to take the subscription of Unacademy, so that can be used. Now firstly I would start, you have just arrived in the morning being live, so let me start with the topic, and in between I will give you about the details of the platform also, upcoming session, because that information is also important. So yes, last year I was very clearly clear, it was very helpful for clearing the university. Thanks a lot ma'am. So yes, Govind Raj, thanks for the appreciation. So let's start with the session now. So abhi sabse pehle what we have to finish, the whole of the anatomy of ankle joint and then the clinical anatomy related to the topic. So this is the target here. So let's start with that, because what I have felt, what I have seen in the previous year, what I have felt that they ask sessions, they ask so many MCQs from the ankle joint, not only for your university exam, prof exam, but also for your next NEET PG. It's very important joint to be studied. Okay, so first thing, a general introduction about the ankle joint. Which type of joint is it? So it's a which type of joint? It's a hinge variety of synovial joint. 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 Okay. Now what you can see here, I first want to explain the articular surface. So I will enlarge this diagram. So I am slightly enlarging this diagram. Now, yeah. So yes, so we have already seen it is a hinge variety of synovial joint. Here I am enlarging the diagram, and what I can show you, the upper articular surface. So upper articular surface is formed by the lower end of the tibia, as you can see here, and the lower end of the fibula. Okay, so upper articular surface is, if you can say, proximal articular surface is formed by the tibia and fibula. It's formed by tibia and fibula, that is the lower end of tibia and lower end of fibula. So lower end of tibia is forming medial malleolus, MM, and lower end of fibula is forming LM, that is lateral malleolus. And also these two structures are connected to each other by a ligament that is called as inferior transverse tibiofibular ligament. So inferior transverse tibiofibular ligament is also taking part in formation of the upper articulating or proximal aspect. Now let me show you the lower one. When you will see the lower or distal aspect, what you can see, a important bone which is shown here is the talus bone. Okay, the superior aspect of the talus bone, as you can see, this is the talus bone. So distal articular surface is formed by superior aspect of talus bone or superior surface of the talus bone. A definite term is used for superior aspect or superior surface of talus, that is called as trochlear surface. Also on its medial and lateral aspect, what you can see, it is having a medial sept and lateral triangular articular surface. So these are the articular areas. So let me write few important points. So all of you please write down the articular and also one more important point is that actually this ankle joint, when we are talking about ankle joint, it's a quite stable joint. Why very stable joint? The reason is that why it is very stable joint, because the tibia and the fibula lower end is connected by a ligament, inferior transverse tibiofibular ligament, and these structure together is called as what? Tibiofibular mortise. Anuj Gaba, thank you so much Anuj Gaba, thank you so much dear. So yes, all my students and all my aspirants are inspiration for me, and they are inspiration for me. So I am so glad to hear this appreciating words. Thank you so much. Now let's see the proximal. So what is the proximal articular surface? Proximal articular surface. When we are talking about proximal articular surface, it is formed by following structure. It is formed by lower end of tibia. The lower end of tibia is forming medial malleolus. Okay, you are from Transworld. Yes, I do remember that Transworlds. Yeah, great. Yes, great Anuj. Great Anuj. Okay. Yes, great dear. So lower end of tibia is medial malleolus. Lower end of tibia is forming medial malleolus. Also the lower end of fibula is forming lateral malleolus, and one more ligament that is connecting the tibia and fibula lower end, what is it called as? Inferior transverse tibiofibular ligament. It is called as inferior transverse tibiofibular ligament. Tibiofibular ligament. So this is all about proximal articular surface. Now let me just give you the details of distal articular surface. So let's move on to the proximal articular surface. Now what I want you all to know, the distal articular surface. So when we are talking about distal articular surface, the distal articular surface is formed by which bone? Talus bone. Which bone, my dear friends? It's the talus bone. So it's formed by the talus bone. Which aspect of the talus bone? Superior surface of the talus bone, and the other term which is used for superior surface of talus bone is the trochlear surface. It's the trochlear surface. It's the trochlear surface. So got it? And on either side of the talus bone, it is having two articular surfaces. It is having two articular ends. What is this? It is having a comma-shaped articular area and triangular articular area. Now the triangular articular area is lying laterally, and when we are talking about comma shape, it is lying medially. So these are the articular areas of the distal articular surface, that is talus. And this together, if you talk about the superior aspect, the lower end of tibia, the lower end of fibula, lateral malleolus and inferior transverse tibiofibular ligament, this is forming a strong tibiofibular mortise. So ankle joint is a very stable and strong joint. So together it is forming tibiofibular mortise. So what do you mean by the word mortise? Mortise, tibiofibular mortise. Can anybody in definite day to day our life we use this structure? Mortise for if you must all be eating, you must will be knowing that we just take the ginger in the tea and we put it in the mortise and then we started crushing it. That is the shape, that is called as mortise, having concavity in the middle. So yes, now the same thing I want to show you in a different diagram which will be better understandable to you. Now see the proximal articulating surface, lateral malleolus, lower end of the fibula, medial malleolus, lower end of the tibia, and what I told you, these two lower end of tibia and fibula is connected by inferior transverse tibiofibular ligament, and these together, so let me use these together, can you see here I am using blue color to highlight this together. As you can see, it is having concavity in the middle, yes, and this concavity in the middle is forming which structure? This is forming tibiofibular mortise. And in this tibiofibular mortise, which is very concave from below, इसमें क्या fit हो रहा है? Which structure is fitting in the tibiofibular mortise? The structure which is fitting in the tibiofibular mortise is the superior aspect of the talus bone. Which aspect of the talus bone? Superior. So see here, this is the superior aspect of the talus bone. Okay, and this is called as trochlear surface. On either side, it is having a articular ends. Articular area, that is the medial and the lateral, which is having the medially comma sept and laterally triangular sept, and it's a very strong and a stable ankle joint. Now next, what I want to explain to you is the ligaments. So yes, ankle joint is a quite stable ligament. Absolutely right, Anuj Gaba. So ankle joint, when we are talking about ankle joint, what I told you, it's a quite stable joint. Why? The reason is why it is a stable joint, because as you can see, the articulation is very strong. For example, if I take an example of glenohumeral joint, that is shoulder joint, what you can see, the articular surface is very shallow. Glenoid cavity is shallow है, बहुत shallow है. But ankle joint में this is not the case. The case is that the tibiofibular mortise is a concave, forming a mortise in which the superior aspect of trochlear surface is fitting, and it's a strong ligament, and it's a strong joint surrounded by strong ligaments and also by the muscle tendons surrounding it anteriorly, posteriorly and also laterally. So important ligaments which we have to study. Good morning, yes, good morning dear. So important ligaments which we have to study in relation to ankle joint is, the important ligament which we have to study in relation to ankle joint is, there is fibrous capsule, there is fibrous capsule, there is medial ankle ligament, there is medial ankle ligament, there is lateral ankle ligament, there is lateral ankle ligament, okay, there is medial ankle ligament and there is lateral ankle ligament. Yeah, good morning everyone. So let's see the features and attachment of each of this ligament. So let's start with the, so firstly I would like to tell you brief about the fibrous capsule. When we are talking about the fibrous capsule, when we are talking about this fibrous capsule, it is attached to all the margins, it is attached to the articular margins of the joint completely. So please write on. When we are talking about fibrous capsule of ankle joint, it surrounds the joint, it is surrounding the joint completely, it is surrounding the joint completely. It surrounds the joint completely, okay, and is attached to the articular margin of the joint. Where it is attached? It is attached to the articular margin. It is attached to the articular margin of the joint. Now, okay, and but there is certain, so yes, that is the correct point, that it is attached to the articular margin of joint, but there is certain gap, okay, it surrounds the joint completely and attached to articular margin with two exceptions. So there is two exceptions in the attachment. What is that? Not exactly at the articular margin, at two areas, the two areas where it is attached. One is antero-inferiorly. So you will see antero-inferiorly it is attached to, antero-inferiorly it is attached to neck of talus, dorsum aspect of neck of talus, okay. And when we are talking about posterior-inferiorly, posterior-inferior, when we are talking about posterior-inferior attachment, it is attached to the inferior transverse tibiofibular ligament, inferior transverse tibiofibular ligament, inferior transverse tibiofibular ligament. So see here, this structure, inferior transverse, and the upper is going towards the neck of talus. So I think it is visible. Are you understanding? Let me know. Yeah. So antero-inferiorly to the dorsum of the neck of talus and postero-inferiorly to the inferior transverse tibiofibular ligament. What is the significance of this attachment? That means fibrous capsule is attached to the whole of the ankle joint completely, but at these two areas they are attached not exactly to the articular margin, but going antero-inferiorly to the dorsum of the neck of talus and postero-inferiorly to inferior transverse tibiofibular ligament. Now thereafter I would like to show you this diagram. So let's move on to this diagram. So here what you can appreciate, the medial. So one of the strongest, so if we compare the ligament on medial and lateral side, which ligament is very strong in case of ankle joint? The ligament which is very strong in case of ankle joint is medial ankle ligament. It's the medial ankle ligament. Okay, which ligament? Medial ankle ligament. So this is medial ankle ligament. Got it? Medial ankle ligament. Now medial ankle ligament is very strong and it is having various parts. If we compare the ligaments, ligament is also lying on the medial and the lateral aspect, but the ligament on medial aspect is very strong. So I would like to firstly describe, and I will write the things, don't worry about this. Firstly, I want to show you the parts of medial ligament. So upper or the proximal attachment of medial ankle ligament is on the lower end of tibia. So this bone is tibia. This is of tibia. What do you mean by of tibia? Medial malleolus of tibia. So upper attachment, as you can see here, the upper attachment of the ligaments are from the medial malleolus of tibia. When you will see lower to that of tibia, these ligaments are diverging. So what you can see, the diverging part. So see here. So you can see on the posterior aspect it is forming this ligament, which I am highlighting with the pink color. Okay. So actually it is having superficial and the deeper aspect. So in the posterior aspect it is forming posterior tibio-talar ligament. In the anterior aspect, see here, this is the slip of, see here. So in the anterior aspect it is forming anterior tibio-talar ligament, anterior tibio-talar ligament, and in the middle aspect it is diverging lower down. So forming tibiocalcaneal ligament. So this is the tibiocalcaneal ligament which is merging with the sustentaculum. See here, it is merging with which structure lower down? Sustentaculum tali of calcaneus bone. So this is the other part of the ligament, and also it is merging with navicular bone tuberosity and plantar calcaneo-navicular ligament, that is spring ligament. So see here. So I am showing yellow color area which is shown to be, so this is tibio-navicular ligament. Here what you can appreciate, this tibio-navicular ligament lower down is merging with, another ligament, and this ligament is spring ligament. This ligament is spring ligament. So see here, I have used different color for highlighting different parts of the ligament which will make you easy to understand. So all of you, just once more I am going to describe the posterior tibio-talar part of the medial ankle ligament is merging with medial tubercle of the talus. Now moving on to the tibiocalcaneal part, as you can see, tibiocalcaneal part is merging lower down. Upper attachment is similar, that is medial malleolus of tibia merging with sustentaculum tali of calcaneus bone. And if we talk about the tibio-navicular part, the tibio-navicular part is merging with the tuberosity of navicular bone, and lower down also merges with the plantar calcaneo-navicular ligament. Plantar calcaneo-navicular ligament is also called as spring ligament. Now what about the anterior aspect? So in the anterior aspect you can see it merges with anterior tibio-talar part. Okay, got it? So yes, Yes, common peroneal nerve is generally injured on the lateral aspect of neck of fibula and it can lead to foot drop. Okay, common peroneal nerve is again divided into superficial and deep peroneal nerve. That means the structures getting innervation from deep peroneal nerve and superficial peroneal nerve, means the structures of the lateral compartment of the leg and the deep peroneal nerve which is going towards the anterior aspect of the leg. All these muscles will be paralyzed. Okay, that is the injury to the common peroneal nerve. The important location is neck of fibula, where it is winding on the lateral aspect of the neck of fibula and it can be compressed or injured there. Okay. Now let's move on with the explanation. So what I have written here, all of you just write down the explanation of the ligaments of ankle joint. Okay. So write on the heading medial ankle ligament. Medial ankle ligament. Medial ankle ligament is also called as deltoid ligament. Is also called as deltoid ligament. So let's write its part. Actually, it's a very strong triangular ligament. It's a strong triangular ligament. It's a strong triangular ligament which is located on medial side of ankle, which is located on medial side of ankle. Is located on the medial side of ankle and it is having superficial and deep part. It is having superficial and deep parts. It is having superficial and deep parts. It is having superficial and that of deep parts. Okay. Now talking about superficial part and deep part, both of this superficial and deep part have attachment above or proximally to which structure? Medial malleolus of tibia. Medial malleolus. What is medial malleolus? Lower end of tibia. Both superficial and deep part is attached above to medial malleolus of tibia. Now what happens in the lower or distal aspect? The medial ankle ligament diverges and it is attached to different parts of the tarsus bone. Okay, it is attached to calcaneum, it is attached to talus, it is attached to the navicular bone. So I would like to explain the lower or distal attachment of each part of the ligaments. Okay, each part of the ligament. So let's start with this. Okay, so all of you please write on the heading. The heading is superficial part of deltoid ligament. Superficial part of deltoid ligament. Now what I told you, when we talk about superficial part of deltoid ligament, it is having following components. So the following components of the superficial part of deltoid ligament is following. It is forming anterior fibers. If we talk about anterior fibers of superficial part, it is called as tibionavicular. Tibionavicular. What do you mean by tibionavicular? That means it is attached to medial malleolus in the upper aspect to which structure? Navicular tuberosity. Navicular tuberosity. Okay, and it also mingles with which structure? Spring ligament. Spring ligament. What is the other name of spring ligament? Plantar calcaneo-navicular ligament. So this is the first part, that is the anterior fibers. The anterior fibers of the deltoid ligament is also called as tibionavicular, attaching to medial malleolus to that of navicular tuberosity. What is it called as? It is also called as plantar calcaneo-navicular ligament. Plantar calcaneo-navicular ligament. Got it? Plantar calcaneo-navicular ligament. Now, so done with this. Now moving on to the next one, that is we have done now middle fibers. Now coming to middle fibers. When I am talking about middle fibers of superficial part, it is called as tibiocalcaneal. It is called as tibiocalcaneal, and tibiocalcaneal part of the ligament. So, upper attachment is again medial malleolus, lower to it is attached to which bone? Calcaneum bone. It is attached to calcaneum bone, and to be more specific, it is attached to the whole length of sustentaculum tali of the calcaneum bone. It is attached to whole length of sustentaculum tali of calcaneum bone. Calcaneus bone. Got it? Now let's move on to the third part, that is the superficial part. Now third superficial part of the ligament of ankle joint, that is the third part. What is it? It is the third part, that is the posterior fibers. When we talk about posterior fibers, the name is given as posterior fibers of superficial part is called as posterior tibiotalar. Posterior tibiotalar, and the posterior tibiotalar, when we talk about posterior tibiotalar, the posterior tibiotalar is attached to the medial tubercle of the talus bone on the medial aspect of the talus bone. Which aspect? Medial aspect. So, upper attachment is medial malleolus, and from medial malleolus to the medial tubercle of the talus bone on the medial aspect. So, this is about the attachment of anterior fibers, middle fibers and posterior fibers of deltoid ligament. So, let us see so we have done with the superficial part of deltoid ligament. I also want to give you the details about the deep part. Deep part of deltoid ligament, a particular name of the ligament is the deep part, that is anterior, that is the anterior tibiotalar. What is it called as? It is called as anterior tibiotalar. So, my dear friends, talar ligament, by the name only it is clear that its proximal attachment will be on medial malleolus of the tibia, and distal attachment will be on the medial surface of talus, anterior part of the medial surface of talus, anterior part of medial surface of the talus. So, yes, this is about proximal and distal attachment. Thereafter, let us move on to the ligament which is attached onto the lateral aspect. So, let us move on to the lateral ligament. So, again I would like to show you a diagram for this, where you can clearly see the parts of lateral ligament. The parts of lateral ligament are, is anterior talofibular, posterior talofibular and calcaneofibular. Three parts it is having. Three parts: anterior talofibular, posterior talofibular and calcaneofibular. Now, here also the proximal attachment is same for the whole ligament, that is lateral malleolus. What is lateral malleolus? Lower end of fibula is called as lateral malleolus. So, superior or proximal attachment is similar. Thereafter, what you can see, it is diverging in three directions. It can so in the anterior aspect, if you will see, it is diverging to form anterior talofibular ligament. It is diverging to form anterior talofibular ligament. This part, okay. That means it is attached from the lower end of lateral malleolus to the neck of talus. It is going towards the neck of talus, and if you will see the part of calcaneofibular, so let me show you the different colors I will use. This is calcaneofibular. So, you can clearly appreciate the calcaneofibular ligament attaches from lower end of lateral malleolus, and it is going towards which bone? Calcaneum bones to that of lateral tubercle of the calcaneum bone. Now, on the posterior aspect, it is again shown. This is the posterior aspect. In the posterior aspect, what you can see, it is diverging and get attached to again the talus bone, okay, get attached to that of the talus bone on the posterior aspect, and on the posterior aspect you can see it is attaching posteriorly, it get merged with that of posterior tubercle of talus. So, these are the parts of the lateral ligament. These are the parts of lateral ligament. So, got it everyone? So, these are the parts of the lateral ligament as shown in the diagram. Okay, let us start with that of explanation. So, write on the heading lateral ligament. Lateral ligament of ankle joint. lateral ligament of ankle joint. Done. So how many parts it is having? How many parts it is having? Following parts. As you can see, it is having following parts. We have seen the name is anterior talo. The name is anterior. The name is anterior talo. Anterior talofibular. Anterior talofibular. The first name is anterior talofibular. Anterior talofibular. Anterior talofibular ligament. The second is posterior talofibular ligament, and the third is calcaneofibular ligament. Calcaneofibular ligament. Actually, in the previous year, it is seen that in the NEET PG examination, these are asked, the parts and also the identification of the ligaments. Okay, so that is important, that you should know the details of these. You should know the details of these structures. Okay, and where it is attached. Okay. Okay, now let's start with this. Yeah. So any doubt regarding the topic? Okay. So yes, who is this? Limbu. Okay. So Limbu is asking, firstly he asked about the topic of foot drop. Now he is asking anti-gravity muscle. Okay. Anti-gravity muscle, gluteus maximus muscle, quadriceps femoris muscle, extensor group of muscle. Okay. So yes, let me know. Okay, Limbu, now let me know what I am explaining. The topic which we are taking is ankle joint. So any doubt in the explanation, you let me know. Now let me start with anterior talofibular, posterior talofibular and calcaneofibular. So anterior talofibular. Anterior talofibular is attached to the lateral margin of lateral malleolus. It is extending from lateral margin of lateral malleolus to which structure? To neck of talus, to neck of talus. Now coming to posterior talofibular. So posterior talofibular is attached from posterior margin of lateral malleolus to posterior tubercle of talus, to posterior tubercle of talus. Now calcaneofibular. Calcaneofibular attached from lateral malleolus and it attaches from lateral malleolus to the tubercle on the lateral surface of calcaneum. Tubercle on the lateral surface of calcaneum bone. So done. Is it okay? Lateral surface of calcaneum bone. Lateral surface of calcaneum bone. So done with this lateral ankle ligament. So in short, we have completed the ligaments of ankle joint. So yes, after that what I want to explain is the relations and all. So before that, I just want to give you an introduction of the platform and also the upcoming free special sessions and the upcoming sessions on the platform of Unacademy. So that is important for you to know. So let's discuss that. So all the students who want to view the free sessions, who want to view the free sessions, free live classes, those who want to take part in free live sessions on the Unacademy platform, what they can do? They can join me by using the code ANAT10. They can join the Unacademy platform, unlock the free sessions, use the code ANAT10 and be the part of free session. So I would like to give you the information about my free upcoming sessions. So let me give you the information. So one of this part, that is, I have started a topic of triangles of neck, in which the first part is already covered up. The second part of the triangles of neck is today 7 p.m. and the third part is tomorrow. So the timing is 7 p.m. Everyone please note down, the timing is 7 p.m. As you can see in the diagram, the timing is 7 p.m. and the second part is today, that is on 28th July, and the third part is on 29th July 7 p.m. So do remember, join me and you can use the code ANAT10 for unlocking. So see here, you can use the code ANAT10 for unlocking the free session who are using the platform of Unacademy for the first time, or used as it a referral code for getting 10% discount if you want to take the subscription of Unacademy. Monalisa Anatomy, this is Monalisa Anatomy, this is the this is my Telegram group, which can be joined by you for getting the updates of all my free sessions, all my plus courses, and also the links of all my classes, and also you can ask all anatomy related doubts in this group. Okay. Now, I would like to again tell you about my unlock code ANAT10. Use this for unlocking free sessions and being the part of taking the subscription of Unacademy. Monalisa Anatomy is my Telegram group. Limited time offer for the iconic subscription. So just grab it, the limited time offer of the iconic subscription where the merging of Prep Ladder and Unacademy has been done. So these are the discounted rates which can be availed by you, and in this discounted rate also where you are getting the access of best online learning platform, that is Unacademy, along with it the Prep Ladder, and use the code ANAT10 for getting 10% discount. Now, how to take the subscription and how to be the part of free sessions on the Unacademy platform. So, आपको क्या करना है? Firstly, you have to download the Unacademy app from the Play Store. Thereafter, you have to find your goal as NEET PG. Then you can search for the top educators or the educators whom you want to follow. Just type their name, and then you will get all the links of free sessions of the educators or the plus courses which is coming up. Use the code ANAT10 if you are using the platform of Unacademy for the first time for unlocking free sessions and being in the part of free sessions. If you want to take the subscription also, you can use this code for additional 10% discount. Now, I would also like to tell you the benefits of the subscription. So, what are the benefits of taking plus subscription of Unacademy? The benefits of plus subscription is that you can be the part of daily live classes. You can be the part of structured courses, daily live classes, structured courses. So, what do you mean by this? If I am talking about daily live classes, that means your course is going to be covered in a very systematic way. Whether you want to target your NEET PG, whether you want to target your INICT, whether you want to target your FMG, whether you want to target your university exam, whether you want to target your next exam. Simultaneously on the platform of Unacademy, various courses are going on. Whichever is according to your preparation, according to your goal, do join that. Okay. And I also want to tell about the positive point about the Unacademy platform is that a single subject contains more than 3-4 educators. So in certain subject we have got 5 educators, 6 educators also for the single subject. So do follow them and follow your educators whom you feel that you can understand the topics, your concepts are getting clear. This is the benefit of Unacademy, which is unique to the platform. Best online learning platform, unique platform. Why? Because online sessions taken by many educators for single subject, live test and quizzes, download the PDF notes. So you can download the PDF notes right after the session. Unlimited access is there. Every 4th session on the Unacademy Plus platform is a doubt clearing session. Now, yes, unlimited access means if you have missed out certain session, you are not able to access certain session and you have missed out and you want to access this afterwards, there you can access this and you can see the recorded version, and there is no limitation that particularly you can view the session for 1 time, 2 time, you can view it number of times. Now, what are the benefits of iconic subscription? The benefits of iconic subscription is that here the merging of Prep Ladder and the Unacademy has been done. So in addition to the benefits of the plus platform of Unacademy, you are also getting the benefits of Prep Ladder. So you can view the video lectures of the Prep Ladder, QBank 3. Also you will get printed notes here in the Prep Ladder, printed notes, rapid revision courses. So all these benefits will be availed by you. So what I suggest, if you want to prepare for NEET PG is your goal, go for iconic subscription, extremely beneficial, getting benefits not only of the plus course, plus sessions of Unacademy, but also of Prep Ladder. Now, I would like to show you this slide where the comparison of the plus subscription and iconic subscription has been compared. So, you can have a look on this and you can have an idea of this costing of 4 years, 3 years, 2 years, 1 year, 6 months, and also for the iconic. Use this code for getting additional 10% discount. Use the code ANAT10 for getting additional 10% discount. Avail this opportunity. It is highly beneficial for you. Now, I also want to introduce this, that is the 4-year subscription of the Unacademy platform, both for the iconic and for the both for the iconic and for the plus course. The cost has been given, the pricing is so less, it is just 60,000 for the plus course and it's just 75,000 for the iconic for the entire 4 years, this is the benefit. Now my dear friends, that means it should be taken by first and second years. What I ideally feel, first and second years can go for this because they can have the opportunity or being the part of prep ladder and being the part of Unacademy Plus course live sessions for the entire 4 years. They can clear their university exam first year, second year, third year, and also they will have the preparation of their next exam. So they can target their next exam also. So, and if you calculate per day cost, it approximately, after using this code and add 10, you get 10% discount, and approximately it comes around 37 rupees for the plus subscription and 43 rupees for the iconic subscription. Now, what other things are launched onto the platform of Unacademy is 2 months subscription, 6,750, boost your preparation by taking 12 months of subscription and getting additional 2 months of subscription absolutely free. NEET PG 2 months calendar details I have targeted. These are the calendar details and what are the session details of test and analysis batch of entire subject and time dedicated for all these entire 19 subject. I would also like to share the NEET PG 2 months calendar for the grand test. Be the part of these grand tests. Okay. Also want to discuss, show you the slide where you can be the part of ultra fast revision batches, all 19 subjects taken by the educators of the Unacademy top educators, and the timing has been designated whether it is getting 3 hours, 4 hours, 2 hours. So just have a look on these timings and have a look and just revise it. For other batches which is coming up on the platform is the Focus FMG batch taken by top educators, Target Next 22 batch, and that of Professional 4-year batch. So all these details and upcoming sessions I have discussed. Now this is something which is very good for the learners, that is the Bucks Bounty. What is it? The Bucks Bounty phenomena is added on to the platform of Unacademy, opportunity for all the learners to report any inappropriate content in the video, be the first to report and win exciting prizes So let's start with the ankle joint. So where we were in the ankle joint. We have already discussed the ligaments of ankle joint. Now I would like to tell you about the relations of ankle joint. So relations of ankle joint. So we will study, firstly I would like to give you a mnemonic and write the relation, and thereafter I will make a diagram so that you will not forget about the ankle joint. So let's start with this. Relations of ankle joint. So what is it? Anterior relation. Firstly, anterior relations of ankle joint from medial to lateral, Got it? The relations of ankle joint from medial to lateral. So the relations are following: tibialis anterior muscle, extensor hallucis longus, anterior tibial artery, deep peroneal nerve, extensor digitorum longus muscle, and most laterally is peroneus tertius. So see here, these are the list of structure which is related on the ankle joint anterior aspect. Okay, there is also mnemonics from which you can understand. So here the mnemonic is: the Himalayas are not dry plateau. Okay, so here what happens? The T stands for tibialis anterior, H stands for extensor hallucis longus, A stands for the artery, anterior tibial artery, N stands for the nerve, that is deep peroneal nerve, D stands for digitorum, extensor digitorum longus, and plateau stands for peroneus tertius. So this is the mnemonic from which you can understand the structures related onto the anterior aspect of ankle joint. The Himalayas are not the dry plateau. Here D for the tibialis anterior, H for extensor hallucis longus, A for anterior tibial artery, N for deep peroneal nerve, and D for extensor digitorum longus, and P for peroneus tertius. P for peroneus tertius. So, is it okay? So, let us move on to the relations of ankle joint on the posterior aspect. So, firstly I would like to give you the relation. I will enumerate the relation and then I will quickly make a diagram of showing the transverse section of ankle joint and the relations on anterior, posterior and lateral aspect of ankle joint. So, all of you do write posterior relations of ankle joint. Now, moving on to posterior relation of ankle joint. Posterior relation of ankle joint from medial to lateral. Posterior relation of ankle joint as we move from medial to lateral. Now, see here, the posterior relation of ankle joint as we move from medial to lateral is following. The relations are of following muscle: tibialis posterior, flexor digitorum longus, flexor digitorum longus, posterior tibial artery, posterior tibial artery, posterior tibial nerve, posterior tibial nerve, and flexor hallucis longus, flexor hallucis longus. Now, here also there is a mnemonic to memorize, and the mnemonic are, the doctors are not here. The mnemonics are, the doctors are not here. The doctors are not here. See here. Now, here T for tibialis posterior, D for flexor digitorum longus, A for artery, N for nerve, that is posterior tibial nerve, and H for flexor hallucis longus. So, all of you just note down the relations of ankle joint, the structures related posterior to ankle joint. As we move from medial to lateral, the structures related are tibialis posterior, flexor digitorum longus, posterior tibial artery, posterior tibial nerve, and flexor hallucis longus. Flexor hallucis longus. Now, I would like to make a diagram for you. All of you just make this diagram along with me. The same thing, but I want to give you a diagrammatic representation of the relations of ankle joint. We will make a diagram showing relation of ankle joint as in the transverse section. So, write down. So, just make an outline. Okay. So, this is talus bone which I have made, this is lateral malleolus and this is medial malleolus. So, this lateral malleolus and medial malleolus, what is it doing? It is giving you an idea that this this is giving you an idea okay. So, this is medial and lateral malleolus, this is the bone part. Now, let us show the structures related on anterior aspect. The structures related on anterior aspect. Got it? In between there is artery, in between there is nerve. So, see here. Now, let us start with the labeling. Okay. These are the structures related on to the ankle joint on the anterior aspect. So, first thing is, this structure is from medial to lateral. The first structures related will be, what is this? This is tibialis anterior muscle. This is extensor hallucis longus muscle. This is anterior tibial artery. This is the nerve. Which nerve is it? This deep peroneal nerve. Which muscle is this? Extensor digitorum longus. And which muscle is the lateral most? PT. What is PT? Peroneus tertius. So, these are the structures which is related to the ankle joint as we move from medial to lateral. Now, coming to the structures related on to the ankle joint as we move from medial to lateral on the posterior aspect. So, write down. Okay. Now, the structures related are tibialis posterior, flexor digitorum longus, then is the artery posterior tibial artery, and then is the nerve, that is the posterior tibial nerve, and the most lateral most structure is flexor hallucis longus. So, these are the structures which is related on the posterior aspect. These are the structures which is related on the posterior aspect. So, I would like to write here, this means anterior, this is showing the anterior relation, this is showing the posterior relation, and what I want to show on the lateral aspect. So, here you can write lateral, two muscle tendons are there, two muscle tendons. What are it? Peroneus longus and brevis, peroneus longus and peroneus brevis. So, done, we have done. So, what is the diagram which I have made? I have made a diagram in which you are seeing the relations of ankle joint. Relations of ankle joint. So, what is it? It is the transverse section, TS, relation of ankle joint at the transverse section of ankle, and showing the relation on anterior, posterior and lateral aspect of ankle joint. So, are you understanding? Let me know. Let's move on to the next. So, we have done with the relation, and next what I want to tell you is about arterial supply and that of nerve supply of ankle joint. Arterial supply and the, so firstly let me move with the arterial supply. So, arterial supply of ankle joint is from following sources. The name of arteries are anterior tibial artery, the other is posterior tibial artery, and also it takes contribution from peroneal arteries. What is the arterial supply? Posterior anterior tibial artery along with peroneal arteries. These are the arterial supply. Let's move on to the nerve supply. The nerve supply of the ankle joint is following sources, that is deep peroneal nerve, tibial nerve, deep peroneal nerve and that of tibial nerve. So, yes, we have done with arterial and nerve cell. What less? It is also important that we should know that what are the movements which is occurring at the ankle joint. The movements are, we have got plantar flexion and dorsiflexion. So, we should know the muscle which is causing these movements. So, let's move on with that, movements of ankle joint. The movements taking place at the ankle joint is two set of movement, dorsiflexion and plantar flexion. So, yes, dorsiflexion. The movements caused by dorsiflexion are following. Dorsiflexors are tibialis, this is the prime dorsiflexor, tibialis anterior muscle along with extensor hallucis longus muscle, extensor digitorum longus muscle and also by peroneus tertius muscle. So, these are the muscle which is causing dorsiflexion of ankle joint. Now, moving with the second, that is plantar flexion. Now, plantar flexion, the muscle which is causing plantar flexion at the ankle joint. Plantar flexion muscle are the muscle on the posterior aspect of leg, gastrocnemius and soleus. Gastrocnemius muscle and the soleus muscle. These are the major or prime flexor. Along with it, plantaris muscle and the muscles of flexor group, that is tibialis posterior, flexor hallucis longus and flexor digitorum longus. So, also done by tibialis posterior muscle, flexor digitorum longus muscle and flexor hallucis longus muscle, flexor hallucis longus muscle. Done with this? So, we have finished with the list of the muscle performing dorsiflexion and plantar flexion on the ankle joint. Now, I also want to give you the few important points which we have to know about the clinical aspect related to ankle joint. So, we have finished with this. Now, let's move on quickly, just brush up our knowledge about the clinical aspect or applied anatomy of ankle joint. So, when we are talking about applied anatomy, actually it is consist of, if we talk about applied anatomy, it is consist of following important important aspect. One is the ankle sprain, ankle sprain. Ankle sprain. So, when we are talking about ankle sprain, actually ankle sprain is more common on the lateral ligament. We have got a strong medial ankle ligament, that is deltoid ligament. So, it is common onto the lateral aspect. The ligaments on lateral aspect is anterior tibio-calcaneofibular. So, actually these are the ligaments, these are the components of lateral ligament which I have already told you. You have to know that when ankle sprain is quite common, it is due to excessive stretching of the ligaments of ankle joint, and the ligament which is involved is lateral ankle ligament. It is caused by fall or twist, or mainly it is caused by inversion. Okay, when the ankle joint is plantar flexed and inverted, as compared to everted force, it is more in the inversion force of the ankle joint, and the lateral ligaments of the ankle joint is stretched. If you want to know the most important component among these lateral ligament which is stretched and torn, the answer is anterior talofibular ligament. So, please write down this important information. Ankle sprain. Ankle sprain. Ankle sprain is quite common in case of ankle joint. Ankle sprain is quite common. It is due to excessive stretching and tearing of ankle ligaments. Which ligament is involved here? Lateral ankle ligament is involved. Lateral ankle ligament is involved because we have got a very strong ligament on the medial side, that is deltoid ligament. So, commonly lateral ankle ligament is involved, and the mechanism of injury, or more commonly the foot position is plantar flex. The ankle is the foot is plantar flexed and inverted, forcefully inverted. This is the mechanism of injury. And among the lateral ankle ligament, the most commonly injured ankle ligament among this, all component is lateral. We have got talofibular ligament. So, all of you please write down, we have got lateral ligament stretch on, in this component we have got anterior talofibular ligament. So, please note down, if you have to select one component among the ligament wing stretch, the most importantly the ligament wing stretch is anterior talofibular ligament. So, done with this. Now, I want to show you a diagram there which you are showing, it's the Pott's fracture. See here. Now, this is the lower end of medial malleolus, this is the lower end of lateral malleolus, as you can see here, lower end of medial malleolus and lateral malleolus. You can see here, this is the torn part which you are seeing. This is the distorted part. Okay, so there is in case of Pott's fracture, actually Pott's fracture is bimalleolar fracture. It is bimalleolar fracture, but at times it is also having a third component, and then it becomes trimalleolar fracture. So, in case of Pott's fracture, it is a condition of fracture, dislocation of ankle joint, and the foot is caught in a hole, or it is forcefully everted. The mechanism of injury is forceful eversion. Okay, so Pott's fracture, and as you can see in this diagram, the involvement is the medial malleolus and lateral malleolus. It goes in a successive form. It has got stages of fracture. So, write down stages of Pott's fracture. Write down the heading Pott's fracture. Pott's fracture. So, it is fracture, dislocation of the ankle. It is fracture, dislocation of ankle joint, and in this condition, the foot is caught in a hole and is everted forcefully. It is everted forcefully it is everted. The stages, the first stage of fracture is fracture dislocation. So, the first stage of fracture is the this oblique fracture of lateral malleolus, What is the reason? Basically, the reason is internal or medial rotation of tibia. This will lead to oblique fracture of lateral malleolus. The second stage of fracture is transverse fracture of medial malleolus. What is the reason? Due to the pull of strong deltoid ligament, due to the pull of strong deltoid ligament. So, due to the pull of strong deltoid ligament, so two fractures are seen, one in the medial malleolus and the second in the lateral malleolus. This is called as which kind of fracture? So, if there is two fractures, then we call it Pott's fracture or bimalleolar fracture. What I told you, not always there is bimalleolar fracture. So, sometimes there is third component also, then it becomes trimalleolar, and in case of third component, there is fracture of posterior margin of lower end of tibia, So, sometimes the lower end of tibia posterior margin is also involved, and in this case it is called as third malleolar fracture or trimalleolar fracture. It is called as third malleolar fracture or trimalleolar fracture. I would like to show you an X-ray explaining this. So, all of you just see this X-ray. So, this is a case of trimalleolar fracture, means third component is also involved, and Pott's fracture is bimalleolar and now it is changing into trimalleolar. So, see what happens here. So, clearly you can see in this diagram lateral malleolus fracture dislocation, medial malleolus is involved, and also the posterior aspect of medial malleolus is involved. So, this is the posterior margin of medial malleolus or lower end of tibia is involved. So, this is actually showing here we can see the lateral malleolus was involved, the medial malleolus was involved, and now the posterior margin of the lower end of tibia is also involved, and this is a case of trimalleolar fracture. Okay. Now, we have done with the ankle joint, but quickly I want to tell you the other important joint which we generally missed out. We have already, so hip joint and knee joint is other important joint of the lower limb, but few more joints which I want to tell you. One is the subtalar joint and the other is the anterior articulation. So, when we talk about subtalar joint, the subtalar joint is actually an articulation which is in the posterior aspect of talus and calcaneum. So, what you can see in this diagram, this is the talus bone and this is the calcaneum bone. So, articulation between the posterior aspect of talus and calcaneum bone. So, write down subtalar joint is an articulation between posterior aspect of talus and calcaneum. What is the name we can give it? It is called as posterior talocalcaneal joint. The name can be given posterior talocalcaneal joint. And my dear friends, so subtalar joint is an example of which type of joint? All of you please note down. It is an example of plain type of synovial joint. At the subtalar joint, inversion and eversion movement occurs. Now, I would also like to show you another diagram. Can you see here? It is talocalcaneo-navicular joint. Actually, when you see the articulation from anterior aspect in which between three bones, here you can clearly see the articulation. This is the talus bone. This is the navicular bone. This is the calcaneum bone. So, on anterior aspect, if we see the articulation onto the anterior aspect of talus bone with the navicular bone and calcaneum bone, so together it is called as anterior. What term you can use? You can use anterior talocalcaneo-navicular joint, and roughly it is an example of ball and socket type of synovial joint. It is an example of ball and socket type of synovial joint. Yes? Okay. So, I would also like to show you, this is again another diagram where I want to explain what is calcaneo-cuboid joint, means articulation between the calcaneus bone and the cuboid bone. So, the calcaneocuboid joint articulation is an example of saddle type of synovial joint. Now, coming to the important joint, which is basically asked. So, important joint we should is the following, which you should not miss out: interphalangeal joint. So, interphalangeal joints are example of hinge joint. It's an example of hinge joint. If we talk about metatarsophalangeal joint, it is ellipsoid variety, and tarsometatarsal joint, it's a plain type of synovial joint. So, please write down this. Type of joint is important for you to know, which is commonly asked as an MCQ session. So, write down tarsometatarsal. What do you mean by tarsometatarsal joint? Tarsometatarsal joint, what is it? So, here you can see tarsometatarsal joint is an articulation between the tarsal bone and that of metatarsal. So, this is tarsometatarsal. These are interphalangeal joints, proximal, and this is metatarsophalangeal. So, this is metatarsal and these are phalangeal. So, articulation between the metatarsal and phalangeal joint is called as metatarsophalangeal joint. By the name only it is clear. So, when we talk about tarsometatarsal joint, the tarsometatarsal joint is an example of plain type of synovial joint. Got it? When we talk about metatarsophalangeal joint, metatarsophalangeal joint. So, metatarsophalangeal joint is an example of ellipsoid variety of synovial joint. Ellipsoid variety of synovial joint. Interphalangeal joints. Thank you Sohail, interphalangeal joint. Interphalangeal joints are example of hinge variety of synovial joint. Hinge variety of synovial joint. So, done. All of you just remember these varieties, which is always asked as an MCQ session for your NEET PG examination. Now, thereafter I also want to show you an articulation between the tibia and that of fibula bone. So, there is proximal articulation and there is distal articulation. The distal articulation between tibia and fibula is an example of syndesmosis. Which type of articulation? Syndesmosis variety. The proximal one is an example of plain type of synovial joint. It's an example of plain type of synovial joint. And if you see the middle one, the middle tibiofibular joint is which type of articulation? Fibrous joint. It is which variety? It is a variety of fibrous joint. So, please note down, there is articulation between tibia and fibula bone at proximal end, that is example of plain type of synovial joint. That is an example of plain type of synovial joint. The distal end is an example of syndesmosis variety of joint. And middle one is an example of fibrous articulation. It's an example of fibrous articulation. So, my dear friends, before ending the session, just a quick recap of free live classes. Don't be missed. Please don't start missing the free live sessions on the platform. So, free live sessions on the Unacademy NEET PG platform can be accessed by using the code ANAT10. Be the part of these sessions, extremely beneficial for you. So, use this, you can be benefited by ANAT10 using the code ANAT10, and you can be benefited by being the part in free sessions. So, free sessions, कौन से free sessions आ रहे हैं, which I am taking on the platform of Unacademy. So, I have already completed the first part, neck part, triangles of neck first part. Today is the second and tomorrow is the third part. So, do join me for these sessions, the part second and the part third of the triangles of the neck. The link is provided on my own group Monalisa Anatomy. Not only this, it is also provided on Let's Crack NEET PG and INICT NEET PG platform of Unacademy. The links will be provided. The first time users should unlock the session by using the code ANAT10. So, you can use the code ANAT10 for unlocking. Shri Rangraj, thank you so much dear. Thank you dear. These are the comparison of the NEET PG subscription compared with that of the Iconic subscription. So, this slide is showing you the pricing of the Plus subscription compared with the iconic subscription of 4 years, 3 years, 2 years and months. What I suggest, the students of first and second year should go for 4 years or 3 years subscription. Iconic subscription details has been given and the pricing has been given. Also the monthly pricing has been shown here. Praveen Sinha, thank you dear. Now I also want to tell the students of first and second year should go for 4 years subscription. This is provided for both NEET PG subscription plus and that of iconic subscription. The pricing is a total of 60,000 for Plus subscription, a total of 75,000 for the iconic subscription. So just go and grab it. So NAT10 is the code which can be used by you for the 4-year subscription. Extremely beneficial for first and second year students. They can prepare their university exam of first, second year and third year students, and along with their next preparation. So next preparation के लिए वो फर्स्ट सेकेंड ईयर स्टूडेंट्स प्रिपेयर कर सकते हैं and also for their examination of next. Now before ending the session, this is an information given for the Bucks Bounty contest. So this is a great opportunity for all the learners to report any inappropriate content. So just go check if there is any inappropriate content provided by the educators of the Unacademy platform and just be the first to report that particular issue and claim your prize. Report it and claim your prize. So all the best. Use this code NAT10 for taking the subscription and for unlocking free sessions on the Unacademy platform. Thank you so much. All the best. Thank you to everyone. Thank you students. Thank you.